Many thanks, Sally, and as you say, a warm welcome to everybody who's able to join us this afternoon, both live and those of you who will be watching this again, I hope. This is the last happy hour of our spring-summer series. We've had over 11 sessions during the course of the last 3 or 4 months, and we're bringing it to a close with a really excellent session looking at integrated care and the relationships between housing, well, across health and social care. And we've got a selection of great speakers who are going to sort of walk us through a variety of cutting edge projects and provide some thought leadership on what is the art of the possible. We're delighted that the UKRI Innovation and Healthy Ageing Challenge are a sponsor of our happy hours, and we're also pleased that Joe McLaughlin from HousingLIN are here, and they're a sponsor of the LIN generally. So Joe, thanks very much for your support during the course of this year. As Sally said, this session's about looking at integrated care. Many of you may know that the HousingLIN actually used to be part of the integrated care network within the Department of Health, and issues around integration have been set out in a variety of both legislation, policy and guidance over the years, most recently in the Adult Social Care Reform White Paper and issues relating to things like integrated care systems. And we'll hear a bit more about that. But part of that has also always been to think about how do we break out of some of those silos, hence why we're looking at how we move from vertical integration to horizontal integration, working across systems, across practices, across professional boundaries. And we've got a variety of really brilliant speakers for you who are going to give you both their personal insights, both from their own experience as well as professionally, about the types of services they're running. Now, we're going to just slightly rejig the order because unfortunately one of our speakers has had to pull out due to bereavement in the family, and we wish Connie all the best and all the best for you and the family at this very difficult time. We're going to actually open with Liz Parsons, who recently wrote a blog for the HousingLIN with Elaine Evans from Grand Union Housing Association, and she's going to give us an update on what's happening across her economy, across Milton Keynes, Central Beds and Bedfordshire Borough Councils. We're then going to revert to the programme, and she will be followed by Guy Harris. Welcome, Guy, again. It's great to see you, Director at Accessible PRS, and also working very closely with somebody who's spoken at a previous happy hour, the team at Agile Homes. He will be followed by Joe McLaughlin, Managing Director at HousingLIN, working very much across the social housing sector, looking at telecare and social alarm solutions, and increasingly about how to create better outcomes for residents in a variety of social housing settings. And last but not least, a dear friend to the HousingLIN, Juliet. Lovely to have you, Juliet, to talk about the update on the Saskia project and some of the innovations occurring within social care. And I know you're stepping in for Valentina, so do wish Valentina our best wishes too. I know she couldn't be with us. So I think that's enough from me. And Liz, I'm going to hand over to you, and thanks very much for, I think you had to rearrange your diary slightly to join us today. So thanks again. And I know you're also just back from leave. So back straight into a HousingLIN session. So over to you, Liz.
Thank you very much, Jeremy, and thank you for the invite. It's great to be here this afternoon. I'll try and share my slides. If everyone can just bear with me a second. Hopefully that's come up for everybody.
Yeah.
Okay, great, thank you. So it's great to be here this afternoon. Really appreciate the invite. What I'm going to do is talk to you a bit about our health and housing partnership working across Milton Keynes, Central Bedfordshire and Bedford Borough to tackle health inequalities. So I'll talk to you a bit about why health and housing, a bit about our partnership, reflect on some of our successes and our learning, and then look forward to the roadmap for the future. So if we start with why health and housing, we know that many of the important building blocks or social determinants of health lie outside the control of public health teams. And my role is based within a public health team, but working across social housing and council housing in our shared public health service area. So recognising that housing is one of those important building blocks, and partnership working is therefore a very important enabler. And by working in partnership across public health and housing, we can develop more effective responses to shared problems. So through joint working, we can address some of the causes of health inequalities, and we can mitigate the negative impacts of poor health on people and communities. So we know that where we live and how we live has a significant impact on our health and well-being. Just looking across where our public health team operates, so Bedford, Central Beds and Milton Keynes, we know that over 80,000 people live either in social housing or council-owned housing. And almost half of those people will live in most 20% of the deprived neighbourhoods in the area. And we know that in those areas, people live on average 7 years less than in richer neighbourhoods. We also know things like smoking is more prevalent in deprived areas, and smoking is a leading cause of inequality in life expectancy. Obesity is widespread, and again, it's around 8% higher for people living in deprived areas. So, by working in partnership, we can improve the reach and impact of public health services. And what we try and do is work with the trusted relationship that housing associations have with their tenants, and thinking about how we can improve the reach and impact of the service. So there's loads more evidence and information than we've got time to consider today, but hopefully I'll start to give you a bit of a flavour. One of the things that we do through the health and housing work is really try and understand and build a common language. So often the starting point is talking to chief execs in housing organisations and saying things like, look at your strategic objectives, your corporate strategy, and then align that with your local health and wellbeing board strategy, and you'll start to see lots of common areas around things like reducing inequality and stigma, safe warm homes, tenancy sustainment, data and insights, and healthy places and place-based approaches. And if you kind of then break that down to a more operational level, you start to understand why things like smoking are important, not just for health, but in the housing setting where you look at arrears reduction, reducing fire safety risk, asset management costs. Things like weight management, residents talk about not having the confidence to do things in their daily lives where their weight impacts on what they're able to do. Drug and alcohol, again, for housing organisations, things like cuckooing, county lines, violence, antisocial behaviour, neighbourhood satisfaction are all linked so closely to the health issues that we know relate to these areas. And by starting to build that common language, we've found common ways of working and ways to help tackle health inequality. If I just come on to talk briefly about the Health and Housing Partnership that we've established with Grand Union and Peabody. The Health and Housing Partnership is a joint funded programme between our shared public health service and these two housing associations. It was launched in April 2022 for an initial 3-year pilot, and our goal really is to create a blueprint for a new way of working between health and housing, building on those common goals. And it's one that we want to create as an opportunity for the housing sector to replicate in different settings and different locations, working with their local public health teams. So just looking now at some of the successes and how we've approached this. In year one, we've worked to identify that strategic alignment that I mentioned a couple of minutes ago around health and wellbeing strategies and housing corporate strategies, and working on developing the shared objectives. We've also worked in partnership very closely with the Chartered Institute of Housing, who've supported us to develop policy and practice. So we've published 2 roundtable papers around exploring the art of the possible and expanding the art of the possible. And we've piloted research with Grand Union through a psychographic segmentation survey to understand some more detail around how residents feel about their health. And that has gone on to inform customer segmentation work, and where we've developed joint initiatives. So some of those initiatives being, we've established 2 community health hubs where we've now had over 1,100 residents come and engage with health services. We have regular support at these hubs from over 20 different public health services, and we've trained now over 200 frontline housing staff in things like very basic advice for stop smoking, for drug and alcohol support, and building awareness around mental health conditions and issues. Through the partnership, we've been able to secure over £100,000 for around 4 housing associations to deliver projects at a place-based level that aim to build these pathways to participation and are founded in co-design and co-production. And then thinking about what we've learned a huge amount over the first year, and some of the things that we've learned are helping to inform the next stages of the work and the programme. And at a kind of headline level, we've learned that there's the importance around the shared priority and common languages, and how important it is to have place-based partnerships that offer residents the opportunity to engage with these services in their communities, because building trust and engagement takes time and really is important in how we can sustain and make this a long-term process change. We've learned that whilst there is considerable appetite to do the work, this all takes time, and this next look forward slide plays to some of those points. So where we're looking to drive real change around process and developing a roadmap, we know and we understand through our common languages around things like tenancy life cycle and process mapping. And some of the roadmap to look forward to drive that change is to look at how we can embed public health interventions more systematically into housing processes. So that whole point around using the trusted relationship that landlords have with their residents to embed some of this work more systematically. So some of our work for the coming year is around customer journey mapping, customer touch points, and really embedding that change. So building on our learning from year one and the good practice that we've started to establish. So as we move forward, we want to embed some of the successes that we've had so far, refine the programme based on learning, and continue to develop resources that can be shared across the housing sector. So I've popped a link here to our latest CIH paper, and I think that's referenced in the blog as well. So I think I'll just close by saying we've had a great first year. We've all learnt a huge amount, and we're looking forward to developing the partnership further. And hopefully the sky is the limit. So it's a really exciting piece of work that myself and our partners feel passionately about, and we really think by working in this way we can tackle inequalities for the residents in our communities that face some of the toughest challenges, particularly through the cost of living crisis. So just conscious of time, and we'll stop there. So thank you very much.
Oh, Liz, that was really great, and I think you demonstrated with abundance, the importance of both the partnership working, but also that horizontal integration. Getting into those communities, but also understanding how pivotal public health is beyond the acute sector and the primary care. It's really part of your programme around community health. So thanks very much for that. It also struck me that what you're talking about is really around primary prevention. You're thinking about the population in terms of their health and well-being, reducing dependency, tenancy sustainment and the like. And I hope we can sort of have an opportunity to have a discussion about that, and where the prevention is not just about health prevention, but also about housing and related support, and how that is a critical part. It reminds me of some of the work that Derby City Homes did around their healthy housing hub as well. Look, I again could talk for ages, but I know somebody who can talk really well and eloquently too. And I'm going to pass over to Guy Harris. Guy, you've long-term sort of support of the LIN as well. Really pleased that you could join us, and I was really delighted to see you in person recently as well. So, but this time I've got you on screen. So over to you for you to screen share.
Great, thank you very much, Jeremy. Sally's got my slides, so hopefully she'll bring those up now. Well, here we go. Great, lovely. while Sally's doing that. Superb. So if we go into the next slide then, and by way of introduction, I set up Accessible PRS to catalyze wheelchair accessible housing in the mainstream housing sector. And that bit about it being in the mainstream is really important to me. So I have 3 key objectives, and they're part of my strategy. And so the first is to increase the supply of wheelchair accessible homes at scale throughout the UK. The second is to level the processes. That looks like older and disabled people being able to find suitable homes through all the same channels and portals as everyone else uses. And the third is also critical, is to rewrite the narrative, around accessibility so that organizations and individuals, professionals understand why inclusion is so critically relevant and how it's commercially beneficial. And so when things are commercially beneficial, more people jump on board and see the opportunities. So you can't see it, I'm a wheelchair user. I had a spinal injury 20 years ago this week, in fact, and I'm a full-time wheelchair user and someone who's had a career in the property sector. So these 2 sides of my life, the pre-injury and the post-injury, both the blissful ignorance of pre-injury and life in a wheelchair afterwards, have given me real insight, not only to the issues, but also the opportunities for the property sector and the seismic quality of life enhancing impacts when we get it right. Additionally, as part of my business, I have a database of wheelchair users all looking for somewhere suitable to live, a home, who bring with them an astonishing range of stories. And really, some of them are unimaginable. So we've got 20-year-olds in end-of-life care facilities, stuck, lives on hold. We have people living trapped upstairs, unable to engage with family, with work, you name it. And I think like key to my understanding, having had the great kind of interest and fun of talking with many people in different areas and levels around the country, we have some ingrained and flawed assumptions around wheelchair housing. So number one, someone else must provide it. We don't need to think about it. Number two, that it's only for the wheelchair user. And somehow we miss that this excludes partners, friends, family. It's the ability to move or travel or work. And so when we think about statistics, I live with my wife and 2 kids. So that's 4 of us that need a wheelchair accessible home, not just 1. Next, the UK planning environment seems to suggest that providing accessible housing is simply an expense to be ignored, but really that misses the joined up thinking and understanding of these different silos and how they can club together. That actually accessible housing is a route to significant cost savings. Next, professionally, disability is still the awkward diversity and inclusion cousin that we don't know how to include or where to sit at the wedding feast. And so there's a lot of soul searching that needs to happen, not really soul searching, but just questioning our implicit beliefs, bringing some of those subconscious taboos to the front to think, is that really what we believe? And finally, there are no shortage of negative reinforced stereotypes. So as a personal experience this week, I'm trying to look for hotels around the country as I take my kids on a road trip for a summer holiday. And implicitly, with all the hotels where there is accessibility, I have to ask, am I a father or am I a wheelchair user? Surely I can't be both. How odd. Awkwardly, I am both. So my question to myself has been, what do I need to do to change the housing sector? And invariably, this includes health. Next slide, please, Sally. So I am a dot joiner. I love problem solving. And very often the best way to look at things is to start with the objective, what it is I'm trying to achieve, and then we kind of reverse engineer. So if we start with the takeaways, some of you may be familiar with Rob Hopkins' book, From What Is to What If, and if you're not familiar with it, great read. In it, he gives us many examples of how imagining what we do want and not what we don't has been the catalyst for change. And so I'm working with a number of organizations, and the first job almost is to create space. So when Jeremy talks about the art of the possible, this is what we talk about. It's what we talk about with Agile Homes, a partner, and just having that little bit of space, as professionals are so busy firefighting the whole time that very often this kind of constant doing of the same thing is simply reinforcing a system that is not working. So create space. The next, as Jeremy said, we need to come out of our silos. So recently, I had an interesting example of this at an event where some housing association CFOs were telling us why they can't do what needs to be done. And to me, this is a really kind of curious oddity. It's, well, if you're not going to do it, who is going to do it? Because you're our housing associations. And so when I put my head above the parapet and push back, joining dots horizontally across silos, joined up thinking, joined up funding, other professionals around the table who I'd noticed had been holding back, jumped in. It's as if we need permission to do what needs to be done. And so we need to understand the broader context. When we come out of our silos and we talk to people we're not familiar with. So in health, that might be going and talking to planning colleagues. If we're in housing, that might be talking to health colleagues. We need to have an understanding of what their obstacles are, what their broader contexts are, and for them to understand from us what the challenges we're doing. And this is where the magic happens. This is where we find the gaps and the opportunities that create change, that make us realize, you know what, we actually, not only do we have to, but we can do things here. So finally on this slide, although doing what we've always done keeps getting the same results, we still need permission to do things differently, it seems. But we are the professionals. We have to own the problems and find ways to solve our housing crises. So organizational responsibility is important too, and it really does create the wide scale changes. But standing around debating the chicken and the egg doesn't move us on. So we need to understand who owns what responsibilities and get behind it. For me, I've had a recent shining example of how personal responsibility with a person with a Knight Frank has just created massive changes, and they're doing some really great things. Next slide, please, Sally. Everyone loves a photo. Some of you might recognize this is Simon Sinek, who did a wonderful TED talk on, it's not the how, but the why. And if you haven't listened to it, another good one. So we need to deliver homes that fit people, not squeeze people into unsuitable properties. And we need to check our understanding of our priorities when we're working at these problems, because it's not what we do that matters here so much as understanding why we do it. When we understand how an affordable, secure, sustainable, insulated, healthy home frees up our capacity as humans to grow, how when we learn more about accepted and researched truths for how our built environments are a critical factor for human development and behavior, from childhood through education, growing and supporting families, our working lives and our aging, into retirement and the kind of deaths that we'd all want, how our homes can increase or decrease our stress levels, help or hinder our immune systems, health and mental fitness, I can't understand how we're where we are with housing, except I can. So to make change, my work has to be about purpose and profit. I work closely with housing providers, Agile Homes, as Jeremy Porteous has mentioned, and there we talk about purpose and, not or, profit. Purpose, because we believe in doing the right things in the right way, and profit, transparent profit, because being commercially viable is the way to scale good ideas. And so just, when we talk about purpose, we're doing some amazing hospital discharge pathway work. We're talking about building with carbon. So in a typical one bed, that looks like locking up 27 tons of atmospheric carbon. We're talking about affordable. So over 90% of the pipeline will be rented at social or LHA level, A+ EPCs, flexible design, rapid delivery, but also and I live in a straw bale home, so I get the effects, a lack of toxins in the building materials, which can have a profound behavioral impact on some very vulnerable people. Next slide, please. And that last point is not really ever talked about or understood. So today is a pretty tight time schedule, and I work with local authorities. I work with NHS England, but I want to give you a kind of case study from my private sector work. So, and this idea of problem solving. So I launched the accessible letting scheme, and for me, it is part. So this is in the private sector, and so for me, this is the start of a longer strategic vision and journey. It tackles the issue of process. So finding a home for those older and disabled people with accessible housing needs who don't have the autonomy to purchase their own home, or who should be eligible for social housing. And like, neither of those are complete fixes. Both are flawed, but you know, I wanted to start somewhere and show rather than tell what can be achieved. I said earlier, accessible housing needs to belong in the mainstream. Only in this way can we create awareness of the needs and the benefits, and can we integrate people into communities and start providing housing equality. So this letting scheme, is it a flawed scheme? Yes, currently it is, because it has to be simple enough for people to understand it and raise everyone up to the same level starting point. And because the UK's existing housing stock is largely inaccessible, this is about kind of spinning up a sort of an integrated process. In it, I talk about the 3 AM test. So it's about providing that information in such a kind of way, a clear way, that people can go online, use those same portals and channels without the need to contact anyone. All the information is there online, and this is part of enabling people to sort of make decisions and control their own lives. The accessible letting scheme is a solution which has buy-in from some key influencers. So you can see these logos in the slide. These are all people I'm working with. They're all behind it, and you know, there are others we're building up. But crucially, what this also allows us to do is to start collecting data that will influence house builders and you know, decision makers. So let me finish. I've got a few points to go through by giving you some early successes, and this is stuff that's been validated by these companies, and why I like to kind of problem solve and get buy-in from the people I'm working with. So these with relevant social posts, they've received up to 4 times usual engagement. They've noticed that the search engine optimization opportunities with relevant content are achieving their first page results. So this is, you know, more reasons for them to do it. Next, they have within these companies accessibility champions and ambassadors who volunteer for the role, because each brings a personal story of why housing inclusion matters for them. So it's not a tick box exercise. This is something that goes much deeper. People who understand that connection between housing, health, lives, families, communities. So next, a case study from Knight Frank, who from an agent who went to value a property for a potential landlord client. This client had inherited the property from their parents, who'd made age-related adaptations, and the landlord had already started the refurb. They were about to rip out these features. However, the agent talked them through the demand and found a family with a disabled child that had been on their books for some time. So long story short, the family was the first applicant to be introduced to the landlord. They agreed a secure long-term tenancy. So that business of security is really important on health. And more accessibility features were refurbed into the home. So this was a triple win for business, for landlord, and for tenant. And best of all, like, I wasn't involved in this process. I heard about it afterwards. So my involvement was the training that I offered to all of the Knight Frank lettings team. So there are a lot of changes happening in the PRS at the moment. I've added DLUC into this slide as they're an important piece of the jigsaw. And I don't want to say too much at this point as we're having an interesting conversation with them. But I think I've identified some opportunities to give them some easy wins as well. So let me finish, sorry, I'm rushing through. Let me finish by telling you that when we approach from a different solution-led angle, not only is positive change possible, it becomes inevitable. Thank you.
Guy, thank you, and thanks for, well, I think you said joining up the dots, and that is integration at its heart, and we're very good at sort of connecting those connections, both from a personal perspective, but also system-wide. And you may be interested to know that the Select Committee for Levelling Up today has launched its inquiry on disabled people and the housing sector, really to look at what's happened since the government issued its findings on the consultation on accessibility, and this includes issues relating to the private rented sector that you and I also are keen to share at a later date. So yeah, thanks ever so much for that.
Thanks, Jamie.
We're going to move on to think a little bit more around sort of the tech solutions and thinking about where that fits in. And Joe is going to share some of the work around HAPPI, and Joe also gave evidence to the first HAPPI inquiry report. So from issues relating to housing for older and aging and disabled adults, right through to think about the tech side. Delighted, Joe, that you could be with us this afternoon, and I hope your screen works and you can find all the stuff you need. Well, yeah, we're just getting there.
Brilliant. Thanks, Jeremy, and thanks for the build-up as well. Much appreciated. Oh, sorry, bear with me 1 second. Yeah, I'm just gonna go in. So my name's.
Sorry, Joe, to interrupt you. I think, well, at least for me anyway, I think you're screen sharing the display with your notes on it.
I think I might be. I was just gonna. I could see that. I was just gonna crack on anyway, but let me just tweak that 1 second. Okay. The joys of sharing the screen yourself. So okay, right, let's try that again. Okay, that all okay? Great. Okay, yeah, so brilliant. Thanks for the build up, Jeremy. So yeah, and it was good to see you. I think it was last week, didn't we? We saw as well, we were at the older persons round table as well, thinking about some of the issues around the digital switch, which I'll talk a little bit about in my presentation. But today I'm going to talk to you for 10-15 minutes or so about housing and integrated care and the work that we do at HousingLIN, but specifically I'm going to use an example of the work we do with Johnny Johnson. So I'm going to talk a little bit about HousingLIN, just to say who we are, set the scene a little, and then I'm going to talk about how a little bit on the difference between vertical and horizontal integration and what we as an organisation mean by horizontal integration and the benefits, I believe in, that we see from being a partner in that system change and with all the issues that we've got going on nationally in the terms of the delivery of services. I'm going to talk a bit as well about our proactive wellbeing service that we've developed with Johnny Johnson Housing Association and how that works. And then I'm going to leave you with a few sort of takeaways really around the role that an alarm receiving centre like HousingLIN can play, working alongside a housing organisation like Johnny Johnson, but a kind of model for how that type of service and that kind of approach can be replicable, in other organisations and other businesses around the country. So HousingLIN's a national alarm receiving centre. We're also a wholly owned subsidiary of Johnny Johnson Housing. And for those who don't know Johnny Johnson Housing, it's a specialist independent living provider, providing homes to around 6,000 people in the Northwest, Yorkshire and Derbyshire, and in the Northeast. And around 60% of the tenure is independent living, so providing good quality, affordable, increasingly digitally enabled accommodation for older people in a mixture of small schemes and then much larger schemes across those areas. So we provide monitoring services not just to Johnny Johnson, but also nationally to around 85,000 or so people in their homes. And we do that on behalf of housing associations, local authorities. We also provide those services to people privately who can contract with us directly. We're a 24/7, 365 alarm receiving centre who's very much in the business of horizontal integration. We're an organisation that does a lot of the coordination. We're sometimes thought of alarm receiving centres as being a fourth emergency service. So people often contact us directly before contacting the police or contacting the blue lights and emergency services. And we act as a kind of triage service, but also a coordination point for enabling people to access other services or be signposted in or directed in. So today's talk is about vertical to horizontal integration, and I just thought I'd kind of explain really what we understand by vertical integration. So what it typically means is where you've got one service provider providing a whole series of services, you know, in a vertically integrated way. So you could just imagine, say, you know, the NHS providing all the services to individuals all through that one single organisation. When we talk about horizontal integration, we're talking more about a coordinated, collaborative way in which services are provided to the individual. So that's what we mean. So I think there's a lot happening nationally. I'm going to talk a little bit about the macro position as we see it, and then, as I say, go into this micro case study about the work that we're going and go into some detail about what we're doing. So thinking really about all the issues that we've got and the things that are happening nationally. We've got crises in mental health and cost of living. You know, we've got a very challenging operating environment in which we are working in, with lots of industrial action across lots of different sectors. And we've also got a lot of competition for people's attention. Lots of issues are, you know, whether around the green agenda, cost of living, other issues, all competing for attention. And then we've also got in the background for us in our industry, working on the digital switch to 2025, which myself and Jeremy have been doing a lot of work around. This is the whole sense that by the end of 2025, all the analog infrastructure that currently supports telephony and lots of other services in the UK is being retired. So it's a huge issue and a really big issue for consumers, but also in independent living. So thinking about horizontal integration, how might we bring together different organisations and involved in the delivery of services, whether they be in housing, healthcare or social care? How might we use digital and data to think about proactive interventions? So thinking about, with all these pressures and all these cost pressures and resource issues, how can we use data and digital that we've got access to think more proactively about where we should provide services and to whom we should provide services where people are in the most need. And then thinking as well about how can we support the management of long-term care needs in the home, because we know, and a lot of those of us on the call who work in housing know that housing is a key part of ensuring people have good quality lives and you know, fulfilling lives. Housing first is something that really supports people in their homes and to live good and fulfilling lives. So we developed this proactive wellbeing service working with our group, Johnny Johnson Housing, and we've looked a lot of the data and information that we get through. So as I say, we've taken around 72,000 calls from Johnny Johnson residents and Johnny Johnson customers over the last 6 months. Now, 3,500 of those have been what would typically be called as false alarms, but we in the monitoring centre know they're not really false alarms. There can be a whole range of reasons why people call in and why they will call into a monitoring service. It can be sometimes as simple as somebody's knocked their device, or there is an issue with their device, and that's called through to us. But we know actually sometimes that those calls are a can opener, really. There's something else is happening there for the individual, and often, and we've seen this through the work, it can be a cry for help, or it can be somebody reaching out, you know, who's lonely or has other issues going on. So we've used that data, and we've been looking at sort of people's call patterns and their behaviours. And what we've done to Johnny Johnson is we've suggested to them that some of the residents and some of the customers would really benefit from more in-depth, more supportive calling. So we run this whole process where, you know, people are identified that would benefit. A wellbeing service assessment takes place, and then a proactive calling process starts with a minimum of 2 calls a week. But these are long quality calls that are really getting to understand what's happening with the individual in the homes. And the calls are made at times to suit the person, and really working through together what outcomes we want from those calls, and what the person themselves wants from those. It's integrated provision in that it sits alongside other services that Johnny Johnson provides, whether that be about money advice or welfare benefits advice, or support other forms of support. And we do a lot of work around digital upskilling and digital training for those residents that might be interested. So that gives you a sort of sense of it. And I think what we're talking about really is around filling in gaps in provision. So this is kind of a typical scenario where somebody's discharged from hospital. They're discharged with the most common sort of pathway, which is pathway 0. So it means that there's no follow-on really. They're just discharged to their home, and lots of assumptions are made about their home and about their housing, that they're going back to somewhere which is safe and secure and doesn't need any support. So that's something where we believe sort of housing organisations and organisations like ourselves can really add some value and can really support and maintain that person out of hospital and away from sort of readmission through the types of services that we're talking about. So a real value add there. And this is just a little bit bringing to life sort of Derek's situation really. So that idea around filling gaps in provision. So what we've built is a kind of system. We just, we use things like wellbeing scores as an easy way of kind of getting a sense of how somebody is at the start of the call. How are they feeling today? It's a kind of simple measure really, just to develop some kind of metric around how the person is. But we use much more analysis around sentiment analysis. So what types of things are coming up on the call? What things are important for the person? What things can we pick up? And then we as an organisation can either do referrals in, so signpost, or link back into Johnny Johnson's community housing officers or community wellbeing teams that can provide that sort of more wraparound support or those other kind of support. So we pick up through the course of this calling, this proactivity, pick up lots of other sort of issues and other kind of things, and we share that back in. All the data, we've integrated it back into Johnny Johnson's main systems, so their customer service advisors, their wellbeing teams all have access to that information, and it's provided across in real time. So what does it do really? This type of service can be used anywhere, anytime, and provided by a 24/7 365 organisation. It means that we can provide the service to people at a time that suits them, whether they're working or they've kind of got a lifestyle where they want the calls in the evening or in the morning. We can provide those. There's environmental benefits, obviously, because you're doing it from a single point into people's homes, so you can kind of catch people at a time that suits, but also you can do it much more quickly, so you can really spin this type of service up very quickly. But ultimately it's also about providing the right level of support, but providing empowerment as well, and an opportunity for people to manage some of their own conditions as well, and through the other support mechanisms that are available. So just wanted to finally leave you with a few things, really, a few thoughts how housing organisations and alarm receiving centres can be part of this horizontal integration and part of this partner for change within this broader system. So, you know, that key role in prevention and early intervention, keeping people out of hospital, spotting things much more quickly and much more early, the right care at the right time and in the right setting with dedicated professionals. So people who know, understand that person, have a lot of background information, a lot of health history detail on that person, but provided to them in their home. And that integrated view of the customer, obviously, as we know, it leads to better and more informed decision making, and we can support that continuity of care. But ultimately, I think the role that organisations here can play is around that digital upskilling, and through this multidisciplinary type of support that's provided, you know, things like emergency response or engagement, you know, we're actually working very closely with people to help tackle their healthcare needs, but also their social and housing needs at the same time, which is obviously, you know, central to improving their overall well-being. So thank you, everyone.
Joe, that was really great, and what a whirlwind of activity. Both, what I was impressed by actually was that sort of pendulum of proactivity and reactivity, both sort of like in terms of the acute, but also that multidisciplinary approach you talk about, and the building blocks right throughout. So, you know, very much integration at the heart again of what you're saying, and how you articulated that in a way that really made sense to me. So thanks very much for sharing that from Astroline and Johnny Johnson perspective. Really great stuff.
Yeah, brilliant. Thanks very much, Jeremy.
Yeah, well, look, stay on, because we're going to have a really good conversation around this. And well, not last but no means least, we're over to Juliet, who's standing in for Valentina. And Juliet, it's great to see, and I know you've been at HousingLIN summits and other happy hours in the past as well. And your role really is very much what was the PSSRU, looking at innovations within a social care sector, and a project that had a slight hiccup because of COVID, but you're back in the loop and ticking. So over to you. Thanks ever so for joining us this afternoon.
Thank you for inviting me to speak, or actually Valentina to speak. And so can you see, everyone can see the right slide, can't they? Yeah, so unfortunately I'm probably not as prepared as I would have liked to be if I had known that I was speaking much earlier on, but I will do my best, so hopefully everyone will bear with me as I stumble through somebody else's notes. So thank you very much for inviting us to speak about our project, which is a Supporting Adult Social Care Innovation project. So this is a 5-year UKRI ESRC funded piece of research. So we're actually getting towards the end of it now. We're approaching the final 5th year come September. And what I'd like to talk to you about today really is the last piece of work that we're doing as part of the project, which is a survey. But before I go into that, we thought it'd be really nice to talk through a little bit about more broadly what the project's about, what we've been doing, and then pick out a couple of headline findings which relate to today's topic of conversation, which is about vertical integration. And I think really what everyone has been talking about today, which is collaboration, and I will say a lot more about that and what we've been finding from our work around innovation. So there we go. Yeah, we're moving forward. Okay, so the aim of the SASCI project was to build, or is to build, evidence about how to support the adult social care sector to start up, implement and spread affordable innovations that work well for everyone. And we added that bit about affordability working well for everyone to really pick up on the idea that we're not just interested in any innovations, we really are interested in those ones that, you know, there's some kind of concern about equity, there's some concern there about the effectiveness of them, and also given the environment we're working in, you know, cost is clearly really quite important. So what we've done over the course of the project, we had a first phase where we were trying to understand a bit more, to characterize and conceptualize innovation in the sector. What's it look like? Who's involved? And kind of questions like that. we mapped a whole bunch of innovations that we found there. We did a literature review and we had lots of discussion with stakeholders, Jeremy being one of them, and also other members of housing associations. And from that, we got a much better sense of what innovation looks like. And we use that understanding in order to sort of move us towards the second phase of the work, which was to investigate the practice of innovation. So it helped us to inform what our case studies would look like. So we've got some case studies of innovations, which are coming to the end now. And the findings from those will be going on our website very soon. And I'm hoping that in the chat will be our website for you to look up later. But so, yeah, so the first stage informed what we looked at. So a few of the things that we felt were really missing from our understanding of innovation were an understanding of innovative organizations. There are some really innovative organizations out there. We don't write about them. We don't talk about them. How are they managing to innovate over and over again? We wanted to look at that. Similarly, there are innovative systems out there. How are they managing to innovate over and over again where others struggle? And also wanted to look at an innovation that has achieved some degree of spread. The general sense in the sector is that, you know, innovations just get stuck in one area. They don't manage to really grow and spread over different places. So those are our case studies. We've got a survey of organizations, which I will talk about a bit more. And we've also had some witness seminars. The most recent one of those was about the Ordinary Lives movement. And if anyone's interested in learning disabilities, I would recommend that you link up to the report that will come out about that, because that was a really interesting session. So I'll talk about the survey a little bit more, but one of the things that I wanted to draw out was what we really found from that first stage of the work, which really connects with what we were talking about today. I think the strongest finding that really came from all the innovations that we mapped and also from the literature review was just how critical collaboration is to innovation. And I'm sure all of you who do innovation know this by heart, but it really was incredibly striking. And I think one of the really interesting things that came through from the mapping of innovations we did was that we had just one innovation in our database that didn't involve some form of collaboration with another organization. It was just one organization on its own innovating. Pretty much, so 88% of them, there was innovation across the sectors. So by the sectors, I mean third sector, private, public, and 45% of those innovations in our database. I mean, this isn't representative, but we don't know what the population of innovations is, but 45% were involving some form of collaboration across all sectors. So private, public, and third sector. So it just gives you a sense of absolutely how critical trust that Liz was talking about earlier really is to innovation and to getting these things off the ground and working. So when we looked at what the collaboration looked like, you know, some of it was partnerships, I think Liz was talking about earlier, but actually much more of what collaboration looked like was probably something much more structured, slightly more impoverished form, I would say, of collaboration, more arm's length, and it really was around kind of procurement, commissioning. It was those type of relationships which really we were seeing being critical in to innovation. So that was something we wanted to look at a lot more, and something that we've been picking up in the survey, something also that everyone has been telling us about as being really tricky in the context of innovation. Okay, so if I talk to you about the aims of the survey a little bit more, so that the idea with the survey is we wanted to survey all organisations in adult social care sectors. That's including housing associations, care, home care providers. It includes local authorities, tech providers. So Joe, it'd be lovely to have you guys responding to this as well. But we really wanted to get a sense of the sort of state of play of innovation in adult social care. So the key things we're looking at in the survey are understanding how innovation and innovative capacity is distributed across the sector. So understanding people's perceptions of what they're doing around innovation, how much it's happening, what kind of value the organizations place on it. Thinking about the capabilities that organizations have to innovate. So to what extent do they feel able to collaborate with others? Do they have the skills and so on to be able to do this? what organisations see as challenges to innovation, and then what kind of support is available and what support people think is missing. And then hopefully we can go on to explore some of the contextual factors if we get a good number of people to respond to our survey. So that's when the kind of call to everyone here. So please respond to our survey. I think the link will go into the chat as well, so you can respond to it there. So at the moment, we sent the survey out mainly to providers, and we've had quite a lot of responses. We've got about 40 or so responses so far, but obviously we want more. The survey hasn't been open that long, and it will continue to be open until the end of the year or so, perhaps slightly into next year too. But yeah, so we want more responses to that. What we haven't and what we're working on at the moment still is the survey for local authorities, because in this we really wanted to explore much more the issue of commissioning. So this was something that really came up when we talked to housing associations, kindly facilitated by Jeremy, so thank you for putting us in contact with lots of people. But yes, trying to manage and how you become or get into sort of manage innovation in the context of that procurement and commissioning process is quite challenging. And we're hearing very much the same thing from commissioners too. So we've been working up a survey that hopefully allows us to pick up and understand that relationship a bit more. We do need some people to help us to kind of test that out and to make sure that survey makes sense, so we're really picking up the things that matter, because this is such a kind of critical part of the process, it would seem, to getting those innovations to really grow and take root and spread across the country. Yeah, just a kind of call to action really. How can you take part? Please do complete the survey. Please ask others to complete the survey. If you're interested, if you're from a local authority, please do get in touch with us and help us to test out the local authority version. And I'd also like to say that the results from that survey will go on our website, and we will put some blogs up about them. And hopefully, if we're invited and if enough of you participate, of course, there will be something to say. And then hopefully we can come back to and talk to you about what we found. So yeah, so I think there's a final slide with getting in touch, which is Valentina's email. But yeah, so thank you for letting me speak today, and hopefully I kind of tied some of it together through the concept of collaboration and innovation. What everyone talked about today, I think, were innovations, and it really illustrated how critical collaboration is. Thank you.
Thank you, and thank you for stepping in at short notice. That was a real great presentation, and it also demonstrates, you know, that a lot of people just getting on and doing things, but at the same time, what you're able to do is to put a process around that, to look at what are those trigger points for innovation, what are the processes, what are the outcomes, and the thread across everything here is about what is it that makes a difference to the ordinary lives of everybody as well, tackling the inequalities, whether it's in health, housing, social care, or in other factors as well, which link into the workforce. Something I know the conversation we had last week with the Minister was really keen to take forward from a tech perspective, for example, those innovations in tech. So yeah, so no, really brilliant. So thank you. Now, we've got about 10-15 minutes left for discussion and Q&A. And thanks everybody who's contributed. And I see some people have sort of posted things in a chat box and then put them back into the Q&A session as well. So we'll run through those in a minute, but I think everybody will agree that, you know, great set of presentations. These and the recording will be made available after today. And then we'll be also publicising and promoting them in our final weekly bulletin of the current series. We're having an August summer break, which goes out this Friday, and then we'll resume again in mid-September and soon thereafter. But enough of the advert, let's get into the Q&A. I think there are a few things which were sort of, which were really about terminology. And while Guy talked about a narrative, the first sort of issues are really probably aimed at you, Liz, wanting just to understand a bit more around sort of what do you mean by various terms. So I think Caroline says, you know, what do you mean by customer segmentation? And somebody else was asking specifically about what is community commissioning. So are you just able to reflect on those two questions to start off with?
Yeah, sure, thank you. And I'll probably start by saying I'm not a public health expert. My background is actually 16 years in social housing, so I'm a bit like the black sheep in the public health family, but very much thinking about building that ethos of a common language. So if we take the customer segmentation question first, and again, from my experience in the housing sector, it's a way that organisations use to kind of cluster or analyse their customers by different characteristics or needs, or how they use and engage with services. So I think for me, it's about understanding more about your customers to tailor your services better, and to be more responsive. And so for us in the Health and Housing Partnership, having the opportunity to link health into the work that Grand Union are doing around their segmentation helps us co-design better what residents need, and to respond better. And then in terms of the sort of community commissioning question, again, I think for me is thinking about the process by which health and care services are planned. And again, you know, part of the approach for the partnership is to move to a more preventative approach, and some of the place-based community ownership around health and wellbeing, and delivering better in a community setting through greater partnership working is what I was talking about there, really.
Oh, thanks, Liz. And I think that sort of probably also fits into some of the work that people like the King's Fund are doing around collaborative commissioning. And again, Juliet, are you picking up different innovations and commissioning styles as well as part of your research?
I don't think we pick up that much around innovations in commissioning, and I'd be fascinated to see if through the survey, because one of the questions in the survey is actually an open response to get people to put in, you know, their thoughts around what they were thinking about when they think about commissioning. Give an example of something you think about and you're doing. And so I'd be really interested to see whether we do get much around innovations in commissioning, because I've had a sort of discussion at a previous panel, and everyone sort of thought, actually, you know, if we're going to really change services and transform things, then we probably need to innovate in commissioning in order to get there. So it does seem really critical. There are a few things going on that I hear about, but to actually kind of see the proof of the pudding and what it looks like in practice, I haven't really heard anything.
Well, that's interesting, because I think it isn't coming. It's on our radar at the LIN. So, for example, had Connie been here, she would talk about some of the work they're doing with the Walsall Housing Group around social prescribing. And I'm just wondering, Joe, in terms of that community commissioning, you talk about procurement and the relationship you have with both housing associations, but also local authorities. Are you finding that there's a more informed commissioning group out there? Are you finding that it's more citizen-led and actually taking some of the stuff Guy's talking about, you know, person-centeredness to the fore? You're on mute, sorry.
Yeah, no, I think we have, I think, in this last year or 18 months, seen a lot more sort of, you know, it's sporadic, but I think definitely we're seeing more sort of commissioning, thinking about more person-centered services, but also thinking about more around the outcomes and what we ultimately trying to achieve. There is still a lot of practice where tech is just being bought, you know, and just not really being thought about what impact and what change it can make in people's lives. But I did a piece of work for the TSA, chairing a group with commissioners and with service providers and some housing providers. We produced some guidance around proactive and preventative service commissioning. So in a minute, I can share the link out to that to people on this call. But yeah, I definitely, through the ICSs and through the work that we're trying to do nationally, sharing best practice, encouraging people to think differently about service commissioning, I definitely think that, you know, we're heading in the right direction. Thanks, Jeremy.
Yeah, no, thanks. And I think that builds on some of the other work that comes through with the TSA and others around co-production as well. So that's part of very much part of the central ethos of the TAPPI project. And Guy, you talked about some of that sort of co-production and involvement. Have you got any thoughts around sort of, market, may not be specifically about market segmentation, but about that relationship with commissioners and procurement, both from a property and asset management perspective, but also in terms of health and well-being?
So thanks. I think it's the co-production piece is really interesting because in the work we're doing, I keep hearing, what everyone wants, their tick list. And so when we're looking at, say, housing for people with learning difficulties and autistic people, which is a kind of great example, we're bringing something new to the table, which solves a lot of the issues. So it's the customization, it's the net zero, it's the rapid delivery, and I think it's for us, it's a question of just getting the pilots down on the ground to show how it can be done, because a lot of commissioners, they seem quite fearful of being the first to do something just in case there's a mistake. Like culturally, we have a great fear of making mistakes, but anyone with kids knows this is how we learn. And so yes, we can't go off willy-nilly and get things wrong, but actually we have to start looking at what is possible and what's out there.
Thanks. And there's another question which I liked, and I may be jumping about a bit, but one of the questions is very much about how do you measure prevention and the value of prevention around, and again, I think a couple of you talked about sort of savings or reducing hospital admissions. Joe, do you want to kick off with that, and then we'll come back to Juliet and then Liz and then Guy?
Sorry, Jeremy, can you just say that again? I was just reading back on some of
the do any of the panel, I'll read it out. Do any of the panelists have a view on how to measure the value of prevention? For example, the savings of reducing hospital admissions, or can point me in the direction of some research in this topic?
Yeah, I mean, so one of the measures that we use, I guess, really, because what we'd say with this preventive service, it's around reducing calls from what we call frequent callers and frequent fallers. So we do monitor and we do look at the outcomes from that. And one of the big indicators we have is a reduction of calls into the centre, because often these are anxiety calls that people are making. And what we've discovered that they kind of, through this more interventionist approach and more kind of tailored person-centered approach, those kind of anxiety calls really kind of drop off a cliff. So I can at another time provide some sort of detail and stuff around those, but yeah, and also monitoring reductions in falls, because often sometimes when people are falling and we get those alarms, we can then help people and signpost them into services that can help with kind of reablement or other services that can lead to falls reduction.
Yeah. Juliet, on the prevention question, is there something that's again coming through in terms of the research?
So I mean, research in this area is incredibly challenging for sort of some of the reasons I think are being picked up by Joe when he's speaking, which is, you need to follow people over kind of a period of time, and where the value from the prevention activity occurs is often in a different sector, a different organization. So how do you link the person that's taken up thing, in A to, the outcome that's happening in B, and perhaps also in C, and perhaps also in D? And one of the challenges I think we have in this space, so there's great, data in health. One of the challenges we have in social care and thread through to housing is that there just really isn't the kind of data. I think there are kind of moves in that direction now, we're starting to see changes, but really what you do need to be doing is kind of following the flows, following people, looking at them through time. I think, Joe, you were able to start to illustrate that with some of the work that you're doing, but really it's about being able to do that journey mapping. Liz was talking about it as well, that mapping over time, seeing people move through the system, understanding how you want that to change, and then what it looked like before, how you want it to change, perhaps some unintended effects as well that might be happening, but really being able to map that out. And then you have the data difficulties because you might only be able to get to some parts of it, and then maybe you need to do some kind of simulation around what might be happening in the other parts. So it's a really complicated issue. I mean, one that we have tried to look at with some of our research, but it's certainly not easy, and particularly not easy at the moment because of the challenges around the points in the system where you'd be wanting to get the data from. So around you know, people coming into getting assessment, you know, that's a critical point at which you want to be trying to understand who's coming in, really difficult because people are so under pressure at the moment in their services. So a lot of kind of thinking, I think, needs to happen so that we can prove the value of prevention in this kind of really difficult environment. But yeah, it's a conundrum, not an easy one. But so great to hear what other people are doing, those.
Yeah, that's really good summary. And I mean, some work we've done is very much from a housing perspective, but one of the things we found is some of the data isn't, you know, across health and care systems can be integrated, but not with housing and support. So again, sort of putting sort of a macroeconomic sort of argument around it, we can get some headline news around sort of global savings. But the point that you just made around sometimes the saving or preventative element from a financial sort of perspective may be a saving to the NHS, but actually still a spend for health, social care or housing. Guy, is that something you're familiar with as well?
Well, totally. It's really nice to hear you all talking about this. And you were in the same seminar at Housing 23 conference. I can't remember the person's name, but the NHS person who was starting to talk. Yeah, who was starting to talk about that research and joining up, like health and housing. You know, health or housing is health, and so this idea that, you know, on the one hand, we've got housing association CFOs who are saying, look, in this silo, we can't afford it. And then you have NHS people who are going, yeah, we can't afford it. It's like, look, it's coming from the same place. Like if you start, you know, a bit of spend to save, provide a decent built environment, provide homes for people, and exactly as Juliet's saying, start mapping those costs. Of course, it's difficult to kind of link all these things, but I think, you know, what Juliet's talking about, if you have the data across a number of people, you know, where our average costs here, like if we're dealing with diabetes, if we're dealing with I don't know, the inability to work, and therefore the you know, the tax receipts, actually what are those costs for people, and where people are living in, you know, poor quality housing or being forced into being dependent on the state, it's a no-brainer. And so very quickly, 20 years ago, you know, as I was sitting in a spinal injury unit in Sheffield, amazing nurses and doctors, thank you. You know, I was looking at the bed blocking that was going on. That's £3,000 per week. And so I, you know, as I came out, I said, well, look, I'm in property. Why don't I just, you know, build some properties and we can have it as transition housing. And everyone couldn't wait to tell me why it couldn't be done. Like, I was in Sheffield, so people coming from, say, Peterborough wasn't going to pay for it because it was in Sheffield. Sheffield wasn't going to pay for it because it was the person from Peterborough. The NHS wasn't going to pay for it because it wasn't on their watch. And it's like, look, I don't care who pays for it. It's coming from the same top pot. It's £3,000 per week, and people's lives are on hold. And then people in a spinal in a general unit who are getting pressure sores, which is costing the state, the NHS, even more. We know there are costs, but someone needs to pay for the research, and there are a couple of people doing it. That Jackie you mentioned, Jeremy, I know HAPPI are sort of starting to look at this this idea of what the costs are. So I think there are lots of people who are starting to get on the same page, and thank goodness for it.
And thanks for that, and thanks for reminding me about the HAPPI work. And Liz, I'm going to give you the final word, because obviously you're working within the health system. We've heard a lot about the NHS, but you also have this critical role about being a housing person working in public health. So again, is the question you're being asked around, you know, how are you going to save us money, or is it about how we deliver better outcomes, which I'm hoping is a bit more of that?
I think it's both, and I think I guess in answer to the question, I haven't got an answer. I've got lots of small answers perhaps, and I know other colleagues have talked about joining up the dots. So I think for me there's a lot of work around that. I think one of the challenges that we talk about a lot is how do you measure the cost of something that didn't happen, that you managed to prevent. So that's one of our conundrums. I think more excitingly, one of the bits of work we're doing at the moment is to try and develop a shared insights and data bank for a metrics bank for the housing sector and health, so we can join up some of those things. So we know at a really operational level, for example, that if someone smokes 20 a day, that costs them £3,500 a year. We know from our own local research and national research that people who live in social housing are more likely to smoke, and those that do smoke are more likely to be in arrears. So there's metrics around those sorts of issues, and so lining up some of those in a bit of a metrics bank will hopefully help to articulate some of this work. On the sort of real preventative side, we're looking at how we can combine a kind of health and housing dashboard to show where you've got housing issues, so antisocial behaviour, arrears, those kind of things, with health, mapping health inequalities, because one of the pieces of work we want to do is more proactively target different areas and communities to roll out our work to on a much more informed basis. We're hopefully going to do some work with colleagues at UCL around some better establishing measures and understanding it. And we've also done some work that we're in the process of developing around social value and perhaps creating some values by proxy for some of these things. And, you know, for example, with work around hoarding that we're looking at, if the average eviction costs around £10,000, if you've got 30 residents who might be facing eviction through hoarding, you know, what's a more holistic solution to that, and how can you support those people to address the issues that, you know, affect them deeply and their tenancy sustainment to find better outcomes. And then the other side of the work that I do is around, again, that, you know, colleagues have touched on this afternoon, is exactly the point around planning and the built environment and how you can embed health into planning. And here in Milton Keynes, we're in the process of developing our new city plan, and health will be a core theme in the new city plan. And so we're holding data workshops with planners. We're really joining up, you know, health as a core theme for Milton Keynes. And so I think that takes you right to the, you know, the really positive end of prevention in how you design cities and places for the future to prevent some of these issues that, you know, we've talked about around the housing stock that we have today and the communities that our residents live in. So lots of different dots to keep joining up, but hopefully if we can, it will lead to some really exciting opportunities across sectors.
No, absolutely, and really great way to conclude this afternoon's happy hour. I apologise to those of you who are still with us. We have run over slightly, but I hope you all agree that the value of the conversation and also the presentations has been really first class this afternoon. There's several questions we haven't been able to get to around toxin levels, around damp and mould issues, around I think Robin talked about thinking much more broadly, not just around the social housing sector, but also the private rented. Really some excellent points there, and thank you everybody for your questions. Again, one for Guy around accessible housing. Perhaps you can follow those up offline, but that leaves me to say is to thank everybody for participating this afternoon. Thank you to all our speakers. Thanks to all our sponsors for all our webinars this series. We look forward to introducing you to our autumn and winter programme in due course. Can I also thank Sally and the team behind the scenes for making this particular session run so smoothly. As I said, the recording and the slides will be available in the next day or so, and we will repeat a call out about those in our weekly bulletin on Friday. But I wish you all a pleasant evening, and look forward to seeing you at a further happy hour on a HousingLIN event in due course. Thanks, everybody. Bye.
Thanks, everyone. Great to see you. Bye.
Thank you.